So you mentioned that initial stage of a migraine attack, the premonitory phase or prodrome. What are the other phases of a migraine attack?
Yeah, so there are four phases that we talk about during a migraine attack. And that first is that prodrome or premonitory phase happening several hours or days before with those non-painful symptoms: fatigue, neck stiffness, sensory sensitivities. The second phase, which occurs in about 30%, is that aura phase with those fully reversible neurologic symptoms, typically visual symptoms like the sparkling lights. That lasts about 60 minutes. And within that period of time, the third phase, which is the pain phase, is when the headache starts. Now, in addition to headache, you can also have neck pain, facial pain, or sinus pain. And in addition to the pain during that phase, people will also experience sensory sensitivities like sensitivity to light, sound, smell, motion, nausea, and vomiting. And their pain will worsen with any type of routine activity, like walking around or even just moving their head around. Then the next phase is the postdrome. That's the fourth phase of a migraine attack. And many of my patients will call that the migraine hangover. Lasts for about a day or two, and really people are just spent. They are tired, they're fatigued, they have difficulty concentrating, and it takes about a day or two for them to get back to their baseline. Now, interestingly, after that postdrome phase, there's actually another phase, which is the time period in between attacks. And that's called the interictal phase. And unfortunately, for people who have frequent migraine attacks or chronic migraine, they may have migraine symptoms in between attacks. So interictal phase symptoms. Most commonly, people will describe sensory sensitivity, so having sensitivity to light and sound during that period of time. But honestly, it could be any of these migraine symptoms we've been talking about.
So how long then can a migraine attack last in total?
Yeah, so if you think about the multiple phases, it really can last over a number of days or even a week during a typical migraine attack. But specifically, the pain phase will last about 4 to 72 hours. Now, there are attacks, though, that can be more severe and last longer, last for maybe a week, and lead to significant disease progression where the pain becomes almost constant for some patients. When an attack is lasting more than 72 hours or more than 3 days, it is diagnosed as what we call status migrainosus. This is very difficult to treat. The longer it takes for us to find an effective treatment option for a specific attack, the more difficult that attack becomes to treat. This is why it is so important to treat early during a migraine attack. Treat when the pain is mild because your options will be more effective at that time.